Today we are going to be talking about an acronym that I use to help people remember things that they should be talking about with their gynecologist. And the acronym is the word PIPES. Okay, so we're going to go through what PIPES is, what that means, and how it applies to you. We are going to talk about what are important topics that you should be bringing up with your OBGYN at your annual appointment and at your 6-week postpartum checkup if you've had a baby. So there are different things that are important questions that you should get answered if you are experiencing any of the symptoms that we're going to be talking about. And it might be helpful for you to kind of bring it up to have this discussion with your OBGYN. And again, these are pertinent whether you're at your postpartum checkup, if you've just had a baby, or at your annual appointment. So these questions kind of hold true throughout a woman's lifetime. And at different points in your life, you may be experiencing any one or more of the symptoms that we're going to be talking about. And I want you to know that with all of these things that we're about to talk about, there is something that you can do to help with it. And tune in till the end. We'll talk a little bit more at the end about what you can do. So it's not just for you to make your healthcare provider aware of it. Let's actually take action steps towards getting things feeling better. So hopefully you guys can take some good information out of today's talk and use it at your next appointment with your gynecologist. So what is PIPES? Like I said, PIPES is an acronym to help you remember topics that you should be talking about at your annual appointment or at your postpartum checkup. So the first P is stands for prolapse. So prolapse is when one or more of our pelvic organs starts to actually fall down into the vaginal canal. In general, prolapse symptoms can be anything from seeing or feeling a bulge in the vaginal canal, feeling of pelvic pressure or heaviness, especially if you've been active or on your feet more or lifting, dealing with a difficulty to being able to have a bowel movement, to changes in your urinary habits, potentially urinary leakage issues. So many different things can show up as symptoms of prolapse. So if you're experiencing any of those, you want to bring that up to your gynecologist to have a discussion about it and have them do an examination to see what's going on. So that's the first P. Now we've got I. I stands for incontinence or leakage. So do you have any bladder leakage? Are you leaking when you cough, sniff, not sure that's really a word, should be sneeze or laugh. A sniff apparently is a sneeze and a laugh together. Anyways, so do you leak when you cough, sneeze, laugh, exercise, when you are lifting up your kiddos, when you have the strong urge to go and you can't get there in time and you're having leakage? So any type of leakage. And leakage is leakage, whether it's a few drops or whether it's Niagara Falls. So don't discount it if it's just like, oh, I just a few drops when I cough or sneeze. I just had a baby. That's normal. It's common. It's not normal. There's something you can do about it. Incontinence also, the I in incontinence also stands for bowel incontinence. So are you unable to control your gas? Are you having gas leakage throughout the day? Are you having fecal leakage? Is there smearing on your underwear, or are you getting strong urges to have a bowel movement and you can't get there in time? So incontinence is both on the bladder and the bowel side of things. If you're experiencing any of those, again, you should talk to your healthcare provider about them. Don't just suffer in silence. All right, we're on to the second P, or the third letter in PIPES, and that is talking about pain. Okay, so if you are experiencing pain in the pelvic region, in the vagina, in the bladder, in your rectal area, in the abdominal area, the low back, you should talk to your healthcare provider about it. Pain is usually a sign that something's going on and your body's trying to tell you something. So don't suffer in silence. Talk to your healthcare provider about the pain that you're experiencing experiencing. And before you go in, try and take note of when you are experiencing the pain. Are you feeling it all the time? Is it only when you do certain activities? Does it get worse after you eat? Is it worse later on in the day? So when do you feel it? Because that can help your healthcare provider try and figure out what might be contributing to it or what the causes may be. All right, so that's the second P in pipes is pain. Fourth letter is E for exercise. And exercise to me, it kind of falls into two categories. One, general level of exercise. So especially if you've just had a baby, is it safe to return to certain exercises? And having a conversation about what you want to do exercise-wise. And ultimately, as we'll talk about at the end here, I think this is a conversation that's best held with a women's health physical therapist who is trained to evaluate how your muscles are going to perform to make sure that you're at a good point to kind of get back into the activities that you want to be doing so that you're not doing any harm, that you're doing good. Exercise to me also stands for exercise specifically for the pelvic floor muscles. So a common term that women have often heard is called a Kegel exercise, which is a contraction of the pelvic floor muscles. So we want to make sure that you are correctly able to contract and relax the pelvic floor, and that those muscles are doing what they need to be doing. And if you don't know how, or you're not sure that you're doing it right, you should ask your healthcare provider, especially when you're going to be going in for the postpartum checkup or for your annual exam, because they can check and see if you are using the muscles correctly or not. And if you're not, again, hold on to the end. We'll talk about what you can do about it. So that is the E in pipes. The S should actually be two S's, but looks kind of weird to write pipes. But S for me stands for sex and for scar. So on the sex side of it, you should be talking with your OBGYN about what's going on in your sex life. Are you dealing with pain with sex? Are you dealing with lack of libido? Have things changed over time? Are you feeling more dry? Is sex not possible anymore because of pain or dryness? So having this conversation, bringing it up, not just answering, fine or okay, but actually kind of diving into it can really help you and your healthcare provider to figure out what might be some options to get that back to feeling good and fun for you. The scar is the second part. So talking about what's going on with scar tissue. So postpartum, you can have scar tissue in the vaginal canal because maybe you had an episiotomy or some tearing, or you had a C-section and you have an abdominal scar. Maybe you've had a hysterectomy or other abdominal surgeries, and you'll have scar tissue that develops there. So from every surgery, we develop scar tissue. That's our normal way that our body heals, but sometimes that scar tissue doesn't ever come back to moving as well as it should be, and it can start to tension or pull on things around it, and that can potentially cause pain and problems. So if your scar is very sensitive, not moving well, you're having pain around it, then you definitely should let your healthcare provider know, because the beauty of scar tissue, especially in the early on phases, is that as it remodels, as it forms the final scars, it responds very well to the stresses and strains that are put upon it. So there are different scar massage techniques that you can do to try and get that scar tissue moving better. So there you have it. We went through the 5 letters of pipes, what should really be 6, but we're not doing the 2 S's. So just a quick recap for pipes. First P, prolapse. Second P, incontinence. Third P, pain. I'm saying 3 P's. Wow, I'm doing really good. Let's try that again. So P is for prolapse, I is for incontinence, second P is for pain, E is for exercise, and S is for sex and scar. So there you have the topics that you should be talking about with your OBGYN or gynecologist at your postpartum checkup and at your annual gynecological exam. So what happens if you're experiencing some of these things? There's many different treatment options out there. I'm going to throw it out there that these are all things that I commonly see here as a pelvic physical therapist, and that's something that pelvic physical therapy is very helpful for, to help gain control of these symptoms. So the one thing that they all have in common is that a conservative frontline treatment option for them is asking for a referral to pelvic physical therapy to get evaluated and see what you can do to help improve any of these symptoms. So just because you're experiencing these, one, doesn't mean that you have to suffer with them, and two, doesn't mean that the only option is potentially surgery or medication. There are other options such as pelvic physical therapy to help.